New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. We just got an email. Dear Dr. Lederman, my name is XX. I don't use names, as you probably know by now. I'm currently being treated for ovarian cancer. I was in remission for approximately 8 months, so a pretty lousy, short remission, and had a recent flare-up. I am being treated with gemcitabine and carboplatin. While I'm very strong and feeling well, I would be very interested in finding out if there is perhaps a less toxic treatment. So I guess the chemo is not so easy, and we know that. In addition, my doctors feel that most likely it will reoccur in the future. I truly feel there must be some way to keep it away, and I'm exploring options. I was wondering if you have had success with your treatment with ovarian cancer. I look forward to hearing from you on your thoughts on this, and perhaps if you feel it would be beneficial to schedule an appointment to speak with you. Thank you for your response. Well, actually, I already wrote her back a few minutes ago while we were on the commercial break. Yes, the answer is yes. It's worthwhile to meet. For most patients, it's worthwhile to meet for many reasons. Number one, I believe that when patients come in and we spend an hour or 2 hours, there's a better understanding of the disease. Patients are given documents about the pathology and the extent of disease if they have never seen their documents. So they have full participation in what's going on. And there's options. If you speak to your own doctor, that doctor probably say, oh, I know about radiosurgery. It doesn't work. If it was so great, I would have sent you. Yeah, because they have their self-interest and pride often to protect. So if you come for a fresh second opinion, you don't have that problem. You just come in. You can tell your doctor. If you don't want to, you don't have to tell your doctor. It's a private matter. You are the president of the United States of your body. You are in charge, no one else. And you decide who knows about your coming and not. But it's a chance for you to learn about options, you to learn more about the disease, you to get hopefully a new perspective and hopefully a better perspective that can share with you many more options. That's why we even call our telephone number on the radio 212-CHOICES, because we believe you do have choices, and we want you to have choices, and we want you always to think about choices, which is why our telephone number is 212-CHOICES. So for this woman, I've written you. I actually invited you to be on our radio show, listen to a show tonight, so you could hear what I had to say. Our success where we aim to beam for ovarian cancer is very high. The vast majority of ovarian cancer patients that we choose to treat and choose us go on to have high success in the targeted area. It's not for everybody, but it may well be for you. And unlike chemo, there's usually not that kind of resistance that develops. And if your remission was only 8 months, it's just a pretty short period of time. From the good news department, remember the 100-year-old woman with bladder cancer, the woman who at 95 was diagnosed with bladder cancer, and she was offered treatment. She said, I'm 95. Why do I need treatment? And then she became 96 and 7 and 8 and 9 and the big 100. And when she was 100 years old this winter, it was actually her birthday's in June, she developed massive bleeding. She lost half of her blood through the bladder and the urine. So can you imagine that? How much blood you'd be losing to lose half of your blood, liters and liters and liters of blood in your urine. She nearly bled to death. Her daughter knew about our work. The woman is 100, so she's not going to have surgery. She didn't want chemo and things like that. It probably wouldn't have worked like our treatment. We gave her, after the informed consent process, 5 treatments. After the first treatment, lasted 15 minutes, she said she felt better, the bleeding slowed down. After the second treatment, 15-minute treatment, outpatient, came in to get a treatment and go home, the bleeding stopped. That was last winter. She came in on this week. No more bleeding. Her blood count has grown back, so her bone marrow's working well. Her bone marrow's making red blood cells, just like it should. She's not losing any more blood. She has no pain. She's doing great. We worked her up. The cancer's nowhere else. She's in remission. Next month, on the 13th, she will be 101 years old. So happy birthday, Miss 101. So happy for you. Gave her a bottle of wine to celebrate the good news. And as Jewish people say, you should live to be Mea Vesrim, 120. And why not? 120. But another interesting woman who came in this week. Oh, our patients are so interesting. Really, there's something to talk about every woman, every man, every patient, every child. Here's a woman who is a 67-year-old from Ecuador, Hispanic woman. She's married with 2 children. She came with her granddaughter and her niece for consultation. She had a lump by mammogram. She couldn't feel the lump. It was on mammogram. She got the mammogram. She had lumpectomy, which is removing the lump of cancer. Then she went to the chemo doctor, and the chemo doctor saw her same day I did. I called up the chemo doctor because I didn't have the paperwork. The chemo doctor said, oh, yeah, she has a 5-centimeter tumor. She needs chemo. What's really strange is her tumor is 5 centimeters, but she has no lymph node involvement. Well, there's a staging system for breast cancer, T1, T2, T3. Well, T1 is less than 2 centimeters, so this doctor said she had a 5-centimeter tumor, which would have made her a T3, and she needs chemotherapy, she said. And so I listened. I said, thank you. But you know me, I like the data. I like the facts. I got the report from the hospital. And yeah, the report said 5 centimeters, but that was for the skin that was removed. The cancer was 1.7 centimeters, which makes it a T1 lesion. It's an early lesion. It's T1, not T3. It's 1.7 centimeters, not 5 centimeters. She most likely can have the radiation only or with hormones. She is so happy. Why take radiation? So if the cancer doctor is asked, hey, they removed my lump of cancer, why do you need any more treatment? Well, there's randomized studies that have looked at that. There's studies that have looked at thousands of women. What happens when you just give the surgery without the radiation? There's a high chance of recurrence. So it's a good question that you thought about, and the answer is even better that it was thought about decades ago, studied, and there's an answer, and that women who have, for breast cancer, lumpectomy and radiation, that's for most women. It's not for every woman. There's not an every in medicine, but for most women, will have better results, longer survival, than if she has surgical removal of the breast mastectomy. So most women that I see would rather have longer survival, less cancer, would rather have their own breast, the own nipple areolar complex, the own sensation, versus to lose all the breast or to have reconstruction. Reconstruction of a breast is not normal breast. You should know that. If you're thinking about reconstruction or mastectomy and reconstruction, you should ask your doctor to show you what a reconstructed breast looks like compared to one's own breast. See what it is. See if that's what you want. And I suspect when you see it, you will be grateful that you listened to this radio show and got this advice. This woman asked, hey, do you want to go see some other doctor? She said, no, I want you, Dr. Lederman. You're the only one that gave me the information and the answers and the data. And I like that you get the data before you speak. Well, I try to get the data before I speak because Sometimes you're smarter if you don't speak. Don't you think? We're live, WOR 800-321-0710. My name is Dr. Gil Lederman from Radiosurgery New York. People often ask these questions, so I always say I'm going to try to give you the answers. We're located at 1384 Broadway, 1384 Broadway. You can see Times Square from our office. We're just between Times Square and Macy's on Broadway. So I think we're the most centrally located cancer treatment center in New York. And that must mean we must be the most centrally located in the world, because New York is the capital of the world. That's what the Pope said. Now, here we have a spacious, modern cancer treatment center. We have our own linear accelerator. We have CAT scans. We have operating rooms, hyperthermia. We're able to heat cancers and help kill cancers with heat combined with focused radiation. We're a private cancer center, so there's no ICU with super bugs and super bacteria and super antibiotics. No, you don't have to worry about that. There's no miles of cold corridors and strange faces and locked doors. No, we know you, you know us. Most likely the costs are less, often very much less. We accept most insurances, Medicare, Medicaid. We answer the phone, so you don't have to worry about a machine or a secretary or a nurse. We love nurses and secretaries, but we think when you're sick and you want to ask a question, it's best to be able to speak directly with the doctor. We have booklets and DVDs to send out to you. We have one about brain tumors and brain cancers, one about cancers of the body, and one specifically about prostate cancer. So during the work week, call us at 212-CHOICES, 212-CHOICES, which is 212-246-4237. We'll mail you a booklet. The best is really to call for an appointment, and we promise, if you wish, to see you within one business day. So we think we're not only super convenient, but super, sending you information, answering your calls, seeing you within 1 day, being super convenient by most buses, trains, subways, Grand Central, Penn Station, PATH, Port Authority. So we think you should give yourself the most chances, give yourself the most choices by calling us at 212-CHOICES. We're going to hear from our friends who are going to tell you about radiosurgery and why we exist. And if you have questions, please call us. And we're live.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR studios in the heart of New York City.